Your metabolic health can do wonders to protect you from cancer prevention. For decades, cancer was primarily viewed as a genetic disease. While genetics set the stage, we now understand that metabolic dysfunction is a fundamental driver of cancer development and growth. Think of your metabolism as the engine of your car. Metabolic health means your engine runs cleanly and efficiently, using the right fuel without producing excessive gunk. Metabolic unhealth is like a dirty engine that sputters, creates a lot of smoke, inflammation, and gums up the works. Cancer cells are not just random growths, they have a profoundly altered metabolism. By keeping your own body's metabolism healthy, you create an environment that is hostile to the development and growth of these cells. Insulin resistance and hyperinsulinemia, the sugar problem. This is arguably the most critical link. When you consistently eat high amounts of sugar and refined carbs, your cells become numb to the hormone insulin. Your pancreas then has to pump out more and more insulin to get the job done, leading to high blood levels of insulin, hyperinsulinemia. Growth signal. Insulin is a powerful growth hormone. High levels of insulin can signal cancer cells to grow and multiply rapidly. IGF-1. High insulin boosts another growth hormone called insulin-like growth factor 1, IGF-1, which is a potent promoter of cancer cell division. Common cancers. This link is strongly associated with breast, colon, pancreatic, and endometrial cancers. Chronic inflammation. Poor metabolic health, especially excess visceral fat, belly fat, turns your body into a state of constant, low-grade inflammation. Fat cells, particularly those in the belly, release inflammatory chemicals called cytokines. Chronic inflammation creates an environment that can damage your cellular DNA, leading to mutations that can initiate cancer. It signals the body to create new blood vessels, angiogenesis, which tumors need to grow and spread. It creates a fertile soil that supports the survival and proliferation of cancer cells. Oxidative stress. A metabolic state plagued by high blood sugar and inflammation generates an excess of unstable molecules called free radicals. This causes oxidative stress, which damages cells, proteins, and DNA. DNA damage is a primary cause of the mutations that lead to cancer. Visceral fat, the deep belly fat, is not just a storage depot, it's metabolically active. It acts like a rogue endocrine organ, pumping out the very hormones and inflammatory signals, like leptin and those cytokines, that drive insulin resistance and chronic inflammation. How to improve your metabolic health to reduce cancer risk. The good news is that metabolic health is largely within your control through lifestyle choices. Prioritize your diet. Focus on food quality. Minimize sugar and refined carbs. This is the #1 priority. Avoid sugary drinks, candy, pastries, white bread, and white pasta. These cause the sharpest spikes in blood glucose and insulin. Embrace fiber-rich foods, vegetables, fruits, especially berries, legumes, nuts, and seeds. Fiber slows down sugar absorption and feeds a healthy gut microbiome, which is also linked to better metabolic health. Choose quality proteins and fats. Include lean meats, fish, eggs, and plant-based proteins. Healthy fats from avocados, olive oil, nuts, and fatty fish, like salmon, help improve insulin sensitivity and reduce inflammation. Consider meal timing. Practices like time-restricted eating, e.g., a 12-16-hour overnight fast, can give your metabolic system a break and improve insulin sensitivity. Move your body regularly. Aerobic exercise. Activities like brisk walking, cycling, or swimming help your muscles use glucose for energy, making them more sensitive to insulin. Resistance training. Building muscle mass is crucial. Muscle is your body's largest glucose disposal site. The more muscle you have, the better you can manage blood sugar. Aim for strength training at least 2 times per week. Prioritize sleep and manage stress. Sleep. Poor sleep, both quantity and quality, disrupts hormones like cortisol and insulin, leading to worse metabolic health. Aim for 7 to 9 hours of quality sleep per night. Stress. Chronic stress elevates cortisol, which increases blood sugar and promotes belly fat storage. Incorporate stress reduction techniques like mindfulness, meditation, or yoga. Metrics to track for metabolic health. You don't need to guess about your metabolic health. Simple blood tests can give you a clear picture. 1. Fasting glucose and insulin. Ask for your HOMA-IR score, which is a calculated measure of insulin resistance. 1. HbA1c. This reflects your average blood sugar over the past 3 months. 1. Triglycerides. High levels are a hallmark of poor metabolic health. 1. HDL cholesterol. Low levels are associated with insulin resistance. 1. Waist circumference. A simple tape measure is a powerful tool. For men, aim for 40 inches, 102 cm. For women, 35 inches, 88 cm. Viewing cancer prevention through the lens of metabolic health is a powerful and proactive strategy. By optimizing your diet, exercise, sleep, and stress management, you are not just being healthy, you are actively creating an internal environment that is resilient, regulates growth signals properly, and is far less conducive to the initiation and progression of cancer. It's about making your body a fortress through daily habits, making it as difficult as possible for cancer to take hold and thrive. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice. Always consult with your healthcare provider for personalized guidance on cancer prevention and health management.